Well, good afternoon. We are going to start the fourth session, and I wanted to take the opportunity to thank the organizing committee, and especially my good friend Rita Basena and also Valerie Vernave for inviting me to chair this session. On behalf of my co-chairman Judith Roque and myself, we are going to present three different lectures, well, two lectures and then the closing remarks. And the first lecture we are going to have is from Alfonso de la Fuente. Alfonso is a gynecologist, and he is in fact now currently the medical director of the Instituto Europeo de Fertilidad in Madrid. And he's going to tell us about the legal situation on oocyte, on social oocyte freezing. Alfonso?
Thank you, Anna. Thank you, Judith. First, I would like to thank, I'm sorry because my voice is a little bit wrong. And I would like to thank to the organizer for inviting me to have the lecture. And it's a pleasure to be once again in Barcelona, like every time. And I'm going to talk about the legal aspects, but not on social oocyte freezing, but in fertility preservation in general. And first, I would like to take a look to the background where we are moving on. And we know, as was repeated many times today, age-related infertility remains a problem, and the age for the first child has increased strongly. And this is a very serious problem that we have in many countries. And many times, ethical concerns around women's reproductive aspect, like surrogation, uterine surrogation, oocyte donors, because they don't have any immediate benefit, and this procedure are not risk-free. And the third one is because fertility preservation complicates things in the field of women reproduction, even in her life. I don't like to dip in this aspect, but I think it's very, very serious. And since induce them to freeze oocytes. There are two groups of indications. The first one is represented by the cancer patient or patients that have any disease that put it in phase of treatment that they may render them infertile. And the second group is what we call social reasons. And yes, there is no doubt that everybody wants to be forever young, but we don't know if this is a good idea. We had to think about that because we know that the inner organs in the body many times don't have the same functionality that the rest of the organ, like the muscle. So we don't have to be in our own convincement. So in why social? It's social because we had two kind of reasons to accept this situation. The first one is because the ovarian follicle reserve is finite, and the second one is because there is a longer life expectancy. And the personal reasons are represented by emotional situation, social conditions, and professional stability. And we really know that medical and oncological situation is much more accepted by the society. And this is not the same for social reason, that many times there is a bad influence for the practitioner and the making policy makers. Sorry. And the question may be why it's not possible to do that in an extensively way. And because it's possible, it's technically possible, then we have to evaluate the risk, the cost, and the effectiveness. And the technique what we are able to do today so far are the oocyte freezing is the most important one, embryo freezing, ovarian tissue freezing, and in vitro oocyte maturation freezing. And I we are going to talk about the legal aspect on any of these techniques. But another question is, it's good to freeze. To answer this question, we had to look at the safe of the technique, the effectiveness of the technique, the cost effectiveness, as was evaluated by a previous speaker, and if is ethically acceptable. We know that oocyte cryopreservation was regulated. The practice committees of the American Society for Reproductive Medicine says that evidence indicates that oocyte vitrification and warming should no longer be considered experimental because the safety of this technique. And even we had changed treatment protocol, and now we use usually recombinant FSH, antagonist and agonist. And this has put, as you can see on this table, the complications in a different context because they are much lower. And if we look at the most important risk that is in vitro fertilization, the variant hyperstimulation syndrome, is much lower the risk because we don't use HCG for triggering ovulation, and we don't transfer any embryo at all. And what about children? Now we know that the more important complication for the children, for the newborn, like low weight or preterm labor, are not related to freezing. And as was communicated before, the chromosomal abnormality are not more frequent. And it's an efficient technique. Yes, we can say yes, because you look at the different, the rates of the different stage of the IVF cycle, you can see they are as good as the IVF with fresh embryos. And the most important data we had to remember, we had to explain to the patient, is that right now the pregnancy rate per thawed oocyte is around 4.5 to 12%, as we know. I don't like to repeat this analysis about cost effectiveness that had already been explained in a well way. And I would like to tell you if this technique is ethically acceptable, and it's technically acceptable because reduce the need to use oocyte donation, and we know what ethical concern this included, and will allow women to become pregnant with their own oocytes when they are older, and that's we call reproductive autonomy, has been named before, and reduce a great number of voluntary abortion and successful IVF cycles, etc. And what does the Spanish law state about fertility preservation in general? In Spain, we have 4 laws. The first one is the 3588 about assisted reproductive technology, what is repealed right now. And there is a royal decree mainly about gamete donors, and the most important one is the 14/2006, is from almost 7 years ago, so it's a little bit old, and is in effect right now. And there is another one, is the Organic Law 2/2010, about reproductive and sexual health, that is in effect right now. It is about the sexual health, but we can see later there is some article that are referring to the reproductive techniques, above all, related to the oocyte freezing. And we know that the age that the reproductive law recommends, according to the royal decree for gamete donors, is older. The donors had to be older than 18 years old. They had to be legally capacitated. The most important point is this one, and when say younger than 35-year-old for oocyte donors and 50-year-old for spermatozoa donors, in order to avoid malformation to the newborn as much as possible. So, if the law permits egg donation for women up to 35 years old, which is based on data showing a decrease in fertility at age of 35, as we know, and then fertility preservation should be advisable when an adequate ovarian reserve, oocyte reserve still exists, which is generally before age 35 to 38, and preferably between 30 and 35 years of age. And the decision to preserve fertility at older ages should be evaluated by a physician informing the patients whose pregnancy rate are directly related to age or oocyte reserve at the time of the consultation, but not only to the pregnancy rate, but the rate of abnormalities, chromosomal abnormalities, malformation, etc. And let me show you several comments about the techniques of fertility preservation. The law, the most important Spanish law, as I told you, is the 14/2006, states that the use of oocyte and cryopreserved ovarian tissue requires authorization, permission by the corresponding health authority. And according to the Sexual and Reproductive Health Organic Law, everyone has the right to freely make decisions that affect their own sexual and reproductive life without limitations. And according to the National Commission on Assisted Human Reproduction, which considers there to be sufficient scientific evidence for the safety of oocyte vitrification, the autonomous communities had to grant general reproduction authorization to perform these techniques. And in any case, we know reproductive rights are controversial, so clinics must meet a minimal set of conditions, such those approved by the National Commission on Assisted Reproductive Human Reproduction. And what about embryo freezing? Embryo freezing is a different technique, and the main limitation for this treatment is the need for male gametes. As you know, the male has to sign the informed consent and has to be able to accept to be the father of the offspring. And so the assisted reproductive law only refers to the possible freezing of leftover embryos with this technique, rather than embryos being used as a personal reserve. So, in addition, the Constitutional Court requires that there should be a concrete and immediate reproductive purpose for creating embryos. And therefore, embryo freezing should not be used for fertility preservation without any medical indications. And what about ovarian tissue freezing? Sorry. The law 14/2006 states, as I told you before, the use of oocytes has to be authorized by the corresponding health authority. But according to the 2008 National Commission on Assisted Human Reproduction, this procedure cannot be authorized out of the context of an experimental or research project. What means we need to have an insurance, we had to do a specific informed consent, etc. And centers should formally request authorization from their autonomous community. And what about in vitro oocyte maturation? We haven't talked about that this morning. And we know the small fear risk associated with this procedure is related to the possible increase in chromosomal and genetic abnormalities. And therefore, in vitro oocyte maturation should not be yet, it's a question, used for fertility preservation without any medical indication. Okay, but I would like to tell you something about Europe. What is going on in Europe? And then we had done a survey, online survey, to the Committee of National Representatives, which I belong to, of the European Society. And there were 4 questions. The first one was, is there in your country any reproductive law? The second one, if yes, is there in the law any reference to fertility preservation techniques? Oocyte freezing, oocyte tissue freezing, embryo freezing, etc. If yes, does this law include any reference to fertility preservation for non-medical reasons? Fourth, in any case, does any center in your country do this procedure for non-medical reasons? And I would like to show you the answer. We have grouped the countries depending on the answer. In the red rows, you can see 3 countries, Ireland, Poland, and Romania, but they don't have law about reproduction. And the blue one is represented by Sweden, Portugal, and Italy. They have law, and they do fertility preservation, but there is no any reference to the social oocyte freezing, social preservation. And on the majority of the countries are included in the green one, represented for all these countries, and they have law. In the law is any reference to the social fertility preservation, and sometimes they do it, sometimes, but they don't do anything about that. And on the orange one, represented by Switzerland, Austria, Greece, and Spain, there is law. The law is any reference to the social preservation, and we do this kind of techniques. And the yellow one is represented by Russia, the Netherlands, and Israel. What they have, they answer yes to all the questions. In summary, we can say from 4 countries, we had no answer about some countries in Europe, and we don't know why. So in Europe, there are 3 countries. There is no law, Ireland, Poland, and Romania. There are 3 countries where there is law, there is no reference to fertility preservation, but they do fertility preservation, Sweden, Portugal, and Italy. 11, the majority law is there is about fertility preservation, and they don't have any comment to no medical reason for doing that, and they don't do fertility preservation. The 5th one, there is law with reference to fertility preservation, for non-medical reasons, but they do fertility preservation, represented by Switzerland, Austria, and Greece, and Spain. And the last one, where everything is yes, Russia, Netherlands, and Israel. Okay, and I don't like to finish my lecture, my presentation, without telling you something. Maybe, as was discussed before, and we have been discussing the whole day about that, we don't know which patient has to undergo this technique or not. And I would like to tell you something, because maybe we had to pay attention to genetic marker, what may say what patient had to do that and why not. That's all. Thank you very much.
Thank you, Alfonso. I would like you to come over because they need to load the other presentation. Are there any questions from the floor? There's one there. Mm-hmm. Mark Grossman.
Thank you for your presentation, Alfonso. Although this is an international symposium, I have a question in local Spanish context. We have spent the whole day talking about oocyte freezing, and now I would like to move to the other side, to the opposite side, the destruction of oocytes, of cryopreserved oocytes. Because according to the Spanish law, cryopreserved embryos and cryopreserved oocytes have the same status. If it is true, it means that a woman cannot decide to destroy their own oocytes, at least as easily as a man would do it. So my question is it true? And the second question is, do you know if there are similar legal restrictions abroad Spain? Thank you.
Yes, you are right. We don't know why. Maybe a lawyer mistake or something like that. Many times, as you know, scientific events are in face of lawyer, the lawyer people, and then we don't know why. But this the current situation in Spain. I don't know if any other country has the same. I think maybe in France, because somebody commented this morning about that. Do you have any idea? No, but I don't know. Yes, I think it's absurd. I don't understand why, because it's a completely different situation. There is a completely different soil, so I don't understand, but you're right. Yeah. We hope to change it. We try to.
Other questions? Any other question from the floor? I have one. I have one with respect to the number of cycles that have been performed in our country, in Spain, on oocyte freezing or oocyte vitrification. I know that you have been involved in the Spanish Fertility Society registry. So is there any question in the registry regarding freezing of oocytes for fertility preservation, both for social reasons and for medical reasons? And if this is the case, can you give us an idea of how many cycles have been performed in our country for these two conditions, social and medical reasons?
Yes. The Spanish Fertility Society registry, there is a question talking about that, but I don't remember exactly. I think the question is for medical reasons and others. Don't specify any other kind of fertility preservation. And I think the last registry is around 150 for each one. I think more or less. Yeah.
So in total 300
yes,
cycles?
but it's corresponding to the 2010, yeah, I think so.
Any other question? I also wanted a clarification because maybe I misunderstood, but you said in one of your slides that oocyte freezing reduces voluntary abortions, and I don't understand this concept. I mean, it's very
Yes,
strange.
because we know reproduction at older ages is many times taken to the patients to a malformation or a chromosomal abnormality, and they had to abort. That's this way. Yeah.
Any other question? Okay, so thank you, Alfonso.
Thank you.